I think one of the things that as a woman I can bring to the table, and it's really critical, is the voice of the customer. Because it's not just 75% of the healthcare workforce that are women, but the vast majority of the CEOs for healthcare in each family are women. And so decision
Right.
makers are women.
This is Inspiring Women. I'm Lori McGraw, and today I'm speaking with Dr. Amy Compton-Phillips, and she is the Executive Vice President and Chief Medical Officer of CVS. She has a long and storied career as a physician executive, leading incredible organizations like Kaiser Permanente as the Chief Quality Officer, as the President of Clinical Operations at Providence, as the Chief Physician Executive at Press Ganey. We're filming this interview during the holiday season. Dr. Amy, thank you for being on Inspiring Women.
It is absolutely my pleasure, Lori. Thank you so much for having me.
So, Dr. Amy, it is the holiday season. You are a senior executive physician for the nation. We're going to be airing this during the holidays. And so I would just love to know, as a physician whose voice is heard by the masses, what is your holiday tip for Americans this year?
Well, we focus so much on others during the holidays and what we can do for our family and being with friends. And I'd say don't forget to take a little bit of time for yourself. Get that exercise, focus on eating something healthy, get enough sleep. Because if you don't take care of yourself, you can't take care of all those other people that are so important to you during the holidays.
Well, that is a great tip because we also know that as we enter the new year, we are entering a time where we know that the costs of health and care are increasing. We know that friction in the system is very, very real, and so this is top of mind for so many people. So, Dr. Amy, you as the Chief Medical Officer of CVS, you are at the intersection of health and care. You are at the intersection of trust. You are at the intersection of consumer behavior. So, as we do start off the year with the trends that we're seeing of costs and friction in the system, we know that we have an erosion of things like dignity, which for people is very important. You've talked about that before. Can you just talk about, as your role as Chief Medical Officer, what are you doing in that role? What's important to you and top of mind for people this year?
Yeah. My personal mission in my career is to make great health and compassionate care available for all. And when CVS came calling earlier this year and asked if I'd be interested in joining, I said, well, tell me what it is you're trying to accomplish. And our CEO, David Joyner, said, we're trying to simplify health. He believes that CVS has the capacity to be the most trusted healthcare organization in the country because we are in 9,000 communities where people live, work, play, pray, do all the good things, right? That human beings want health to be available to them when and how they need it to support them living their best lives. We don't want it to be inconvenient and expensive and make our lives worse inadvertently because they bankrupt us, right? Which is what
Right.
happens so often with the unbelievable complexity of the system that's evolved in the US. So as CVS Health, what we're trying to do is to say, all right, we have 9,000 access points in stores. We have an insurance arm in Aetna. We have the capacity to make medications available affordably and close to home. And so, how can we put those assets together in a different way, leveraging our healthcare delivery through MediClinic, through virtual care, through Oak Street Health, to make it so that care is closer, is less disruptive? You don't have to go to a hospital or drive 100 miles to the nearest academic medical center to get what you need. We can actually deliver that kind of health close to home. And so that's what we're trying to do is to make great care accessible, affordable, simple, and worthy of trust.
And you also know, Dr. Amy, that the complexities of large organizations at the scale that you are at, that there are also sort of like interests and business reasons why that becomes even more complex. So I want to dig into this is Inspiring Women. And I want to dig into for yourself as a senior leader, as a physician, as a woman, the unique aspects that you have that you bring to the leadership role that you have. There are so many women in healthcare. 75% of the women on 75% of the workforce in healthcare is women, yet less than 20% of the leadership positions are held by women. So, as one of those less than 20% at a most senior level, what is your unique view or aspect that you're bringing to that, knowing that there are different complexities in the business decisions that need to be made to deliver the trust and dignity that you're talking about?
I think one of the things that as a woman I can bring to the table, and it's really critical, is the voice of the customer. Because it's not just 75% of the healthcare workforce that are women, but the vast majority of the CEOs for healthcare in each family are women. And so decision
Right.
makers are women. And so, how do we develop systems of care? How do we develop infrastructure that appeals to the people who are making those kinds of healthcare decisions? And one of the things we need to do, and back to something that you said at the intro, Lori, is we need to make the right thing easy to do. And so, how do we make the right thing the easy thing? And that Mark Twain quote that sorry, I wrote a long letter. I didn't have time to write a short one. It
Right.
takes design thinking and it takes intentionality to make things easy. We've done the easy thing over in healthcare since the end of World War II. And the easy thing is to add more, add more, add more. And what's happened with the adding one more thing is that we kept putting stuff between a person who needs help and a person who can help, right? So you've got a doctor and a patient, or you've got a nurse and a patient, or a nurse and a consumer. I don't care. Like choose your archetype. Um, and we've put things like um, electronic medical records, so computers that are people are typing. Electronic medical.
I worked on that for years. I'm part of that.
Yeah, me too. Like that was part of it. Yeah, I'm part of the problem. But yeah, so put that between the doctor and the patient. We've put narrow networks, insurance plans. Just think of all the stuff, the rigmarole you go
Yeah.
through today to get care that we put between patients and people who can help them. And so part of our design thinking approach that I think appeals to these busy moms, they're taking care of kids and their aging parents and trying to go to work at the same time, is how can we start taking layers out and simplifying and making the right thing the easy thing? And I think it's that is something that kind of voice of the customer and that design thinking is something that if it's just boys in the room, they may or may not be as focused on without having the key voices of the people we're serving.
You've focused on quality as something very important in large scale systems like Kaiser. You've focused on delivery of physician services at large scale systems like Providence. And so, as these different choices that you've made, the leadership choices that you've chosen for what is next at various points of your extraordinary career, Dr. Amy, pushed, pulled, self motivated. How did you make those choices? So many women in their career, it could be they were pushed to the next thing, they were pulled to the next thing, or they decided they wanted to move to the next thing themselves. What were your choices?
So I have to be honest. I have almost always been tapped on the shoulder and been asked to do the next thing. And so that tells me a couple things. One is, I haven't raised my hand and said, hey, can I choose me, choose me? Um, so, which is really interesting because I often have young women come up to me, skilled, brilliant young women come up to me and say, how do I get the next job? And I said, do really,
Mhm.
really well at your current job. Be fantastic. Execute. Don't be focused. Don't always have one eye on the horizon. Do the job you were hired to do, and people will talk to you. But the other thing that's really important is be the pay it forward. So I really
Mhm.
try hard to pay it forward and to look around and to say, wow, this person is interested, is motivated, is doing a great job. What can I give her as the next thing to stretch her and for her to spread her wings and build her goals? So I feel like because I had had people tapping me on the shoulder and asking me to lean in. My job now is to tap the next generation on the shoulder and ask them to lean in.
Awesome. So, as somebody who has been pulled, that means that you probably have been given choices and you've said no to some of them. What was something that you said no to earlier on that perhaps you've had second thoughts about today?
Yeah. I said no to what I thought was my dream job back when I was working with Kaiser. I was living in the Mid Atlantic states, so outside Washington D.C., and I got offered a national job at the main headquarters in Oakland, California. And or I got asked to, hey, would you be interested? We really think you do it. I can't say it was an offer, but we really love you to do this job. And my husband's company had just got bought. He had a 2-year earnout in the company, so he had to stay for 2 years. I had two kids in school, and it just was not the right time. We had just like we were going to renovate our kitchen. We had just destroyed the kitchen. Like our things on the house, there was no kitchen. So I had to go back to the leadership and say, this is my dream job. I so wish I could take it, and I can't. Now is not the right time for me and my family. And I was telling a colleague at work, man, I just passed up the brass ring. This would have been the coolest thing ever. And I had to say no because it was the wrong time for my family. And his advice to me, I will always remember and can't thank him enough for, was, Amy, once they know your name, they'll be back. And they were.
Mhm.
A couple years later, they came back and said, "Hey, how about this other thing?" and the other thing worked out, and so I'm, here I am today. So I think having your priorities clear, knowing what you want to accomplish, not just in your career but in your life, and what's important. My family is still the most important thing to me, and if it came around again, I would have said the same thing, because for my family, I had to make the right decision for all of us, not just for my career.
Well, we talked earlier about, women usually are the CEO of the family in terms of making many choices about, where you're going to be, whether things are the right choice. But as a woman leader, again, with the storied career that you've had already, Dr. Amy, if you could just reflect back, women often say yes to many things along the way as well. Was there ever a point where you said yes to something that today you might not have said yes to earlier on?
Um, I because I have I was one of those women for a long time now. My kids are out of the house. I unfortunately lost both my parents and my husband's parents, so my life is actually a little simpler. Um, but because I always knew I had to make choices. So,
Hmm.
going through medical school, you make choices. Are you going to go out with your friends on Friday night, or are you going to study for that final that's on Monday? You make choices. And so I've always been pretty clear. I have had to make choices. I could not say yes to everything, stay sane, and get done what do I want to accomplish. So I do remember at one point, and back to the what I recommended for the holidays. At one point, I was saying yes to too much at work and not taking care of myself as effectively as I thought I would. And well, I think she was about in fourth grade, sorting in fourth grade, maybe 10. My 10-year-old daughter came up to me one day at dinner as I'm like slamming pans and trying to make her like supervising homework. And she comes up and puts her arm on me and says, "Mommy, do you need to go to the gym?" So um, I I think like yes, honey, I do. Thank you. Good choice.
Yeah.
You know, so I think like making sure that you know what's important to you, what's your North Star, and then ensuring you're not saying yes to too many things over here that you can't go on your North Star over there is a critical life skill.
Well, you have been very vocal over years talking about sort of, making the right choices as a woman leader for your family and always having that as your priority. From my viewpoint, Dr. Amy, it is more complex for earlier stage women who are rising stars moving into leadership to balance the objectives that they have for their family and their careers. So, as you think about the women that you advise today, how do you sort of help those that are aspiring to leadership positions to navigate the family dynamics that they're working with, as well as the leadership aspirations they might have?
Um, I think to have courage and do what's right. There was a good chunk of time during my career, and by the way, do it in conjunction with your life partner. So,
Hmm.
at one point during my career, my husband's job was incredibly busy, and we had two kids. My job was incredibly busy, and we sat down and had a conversation and said, I'm going to go part time. I I can't do all of this. It's not working for either of us. We're losing our minds, and one of us needs to do something less so that we can take care of the two kids. At that point, we had four parents, two of whom were failing, in different states. And it's like we need to be able to dial it back. So I went part time, and then over time, as the kids started getting a little bit bigger, and if you say you're going to work 5/10 time, of course you work 6/10 time, and then of course as I said, okay, well pay me 6/10 time. Well, then I started working 7/10. So I just started going back up and up and up. But then when I got offered and took a big job across the country, my husband said, okay, now it's my turn. I'm going to work part time. And we've had to navigate like over the years how we balance life and how we balance careers. But because I had a life partner I could do that with, it gave us optionality that I think we wouldn't have had without that. I don't know how I would have finished life. And oh my word, like moms who are raising kids and working, I just have the ultimate respect for because it is not an easy balance.
Well, I also think it takes really strong dialogue and open dialogue about what people actually want in terms of what's next and how to navigate some of those. And so, Dr. Amy, just, you've always said that performance gets you the podium. And that's been advice that very strong advice that you've given to women leaders and all leaders, actually. But at some point, for women who are aspiring to the next level of leadership positions, performance is not enough. I'd love to close out this inspiring women conversation because, again, the jobs that you've had, the leadership journey that you have been on, and now in the position you hold today, there has to be something a bit more than just excellent performance. So, what is it that is the special thing about you that you've been able to do to accomplish, to be pulled as you have been, that you might advise others who are looking to aspire to their own leadership levels?
Um, I'm going to tell you a small story and then my take home message from it. At one point, in one of the big jobs I had just moved into, I was the only woman on the leadership team, and most of the conversations that mattered seemed like were happening in the hallway outside of the office on the way to the restroom. And everyone else went to the men's room, and I went to the women's room, right? But as I'm standing out in the hallway, all these tall guys were standing around having conversations. And I'd come up and I'd chime in, and nobody would honestly hear what I said. It's not like they didn't even react to what I said. They didn't hear what I said because they were all talking over my head. So it was so interesting. So I brought in a bunch of platform shoes into my office so that I had options to go with each outfit. Right? Like I had brown ones and black ones, white ones, or whatever. And I kept them in the drawer of my desk. And anytime I was going out to the ladies' room, I pulled out my platform shoes and popped them on so that when I met people in the hallway, I would be at their eye level and we'd have conversations and they would hear me. And but because they just literally would not hear me. Like it's not that they were intentionally ignoring me, but But so my leadership lesson is, to actually figure out what's working and what's not working. And when you need to, don't be afraid to pull out the tall shoes.
That is awesome. This has been a great inspiring women conversation. I have really appreciated speaking with Dr. Amy Compton-Phillips. And Dr. Amy, thank you so much.
Thank you so much, Lori. It's been my pleasure.